Thank you for attending the webinar, Community Information Integration and Central Patient Attachment Registry, also known as CII-CPAR. This session will focus on the physician experience using the Healthquest EMR. My name is Sheena George, and I'm the CII-CPAR PCN lead with the AMA's Accelerating Change Transformation Team, also known as ACT. Our physician panel includes Dr. Chris Lay, a family physician from Edmonton North PCN, who started accepting patients around the same time as when he joined the CII-CPAR program, and Dr. Janet Craig, a family physician from Edmonton West PCN. With a well-established panel, she joined CII-CPAR during the COVID pandemic in the spring of 2020, so when COVID first hit Alberta. The session will cover why CII-CPAR is important, how it works in the Healthquest EMR, benefits to patients and providers who use the program, and the physician effort. What does the effort look like once the clinic is actually live? So Janet, may I please ask you to start us off with a high-level overview of the eHealth landscape and why CII-CPAR is important?
Sure, Sheena. So let's start with NetCare, which most family physicians are very familiar with and are using. AHS is in the middle of implementing ConnectCare, which is a provincial electronic health record. And over the next 3 years, 1,300 different systems will be converted to one called ConnectCare. Information from AHS is supplied for viewing in Alberta NetCare. Now, community family physicians and specialists are using their community EMRs, and they're receiving lab reports, diagnostic imaging reports, and some hospital reports through e-delivery. Remember that there are no plans for community EMRs to be replaced by ConnectCare in the near future. And now we have Community Information Integration, or CII, and this allows two-way data flow with the 5 conformed EMRs that the vast majority of physicians use in Alberta. CII also has two-way flow with the Central Patient Attachment Registry, or CPAR, and now the system knows which patients belong to which provider. But the best thing about CII-CPAR is e-notifications, which allow notifications of emergency and hospital discharges to come straight to your community EMR. Information is also collected by the Healthcare Data Repository for analytics and quality improvement. And later, community EMRs can push information to the My Health record.
So thanks for showing the value of the CII-CPAR program within that Alberta context and how it really is the program that's connecting community to the rest of the health system. So can you walk us through how the Healthquest EMR shares that select data?
Right. So we're using our community EMRs in our clinics, and select fields, the information in them will flow to the CII data hub. And then from there will flow to either NetCare or the Healthcare Data Repository. In Alberta NetCare, a Community Encounter Digest report can show information over the past 12 months from our EMR. And I'll go into that in more detail in a little bit. The Healthcare Data Repository information is only being used for analytics and quality improvement. The government already has all our billing information. There's nothing new there. In NetCare on your homepage, you'll find the Community Reports tab, and then the Community Encounter Digest sits there. So if a patient goes to emergency, an emergency physician could click on this and then could see how many times in the last year that patient has seen their family physician. Do you want to show the Community Encounter Digest in more detail, Sheena?
Yeah, before we go into that, I'm going to actually ask you about sharing about the benefits for CII-CPAR and specifically looking at that snapshot of information.
Right. So right now we know that over 250,000 unique patients encounter data has been shared and uploaded into the Alberta NetCare portal. So that's really good news, but we've got some way to go and some room to grow. Absolutely.
Thanks for that, Janet. So let's actually look at what a CED looks like. Let's get through that sample.
Okay. So like I said, if you click on that tab on NetCare, this is what you'll see. And you can see that the community encounter part has the date, the clinic, the name of the provider, and some brief information about the encounter. Other fields can also push information to NetCare, such as some vitals like blood pressure, height, and weight, allergies, referrals, and immunizations.
So seeing that that's what a snapshot of care would look like in NetCare in that community encounter digest, help us understand what the data mapping session would look like with the Healthquest EMR.
Right. So, like I said, only certain information from the EMR flows to the to NetCare to make up the community encounter digest. So this slide is a good summary of the specific fields in HealthQuest where information is shared to the community encounter digest. And if a field is not highlighted, then information from that field does not leave the EMR.
Thanks for sharing that, that Janet, because sometimes I think when we look at this, it looks really complex and challenging, but I like how you've simplified. It really is a customized approach. So this is about sharing the encounters. There's also another option to share community consult reports. So Chris, can you tell us more about that?
Yeah, thanks, Sheena. So the second type of information that's shared are the community consult reports, and they're shared and displayed in Alberta NetCare. So the same patient consult report PDF file that's sent to the referring provider can also be shared to Alberta NetCare. And the specialty provider has the ability to choose which reports to upload and which one to not. And the information is uploaded through the CII data hub and displayed as a PDF, and it doesn't go to the healthcare data repository. Consults can come from specialists, family physicians with a special interest, as well as PCN multidisciplinary team members, such as dietitians. And this features allow all of us to be able to contribute to the system. Now, let's take a look at how you share consults with NetCare. So within HealthQuest, sending letters to NetCare or removing previously sent letters can be done with the click of a single button. One click submit means no interruption to your existing workflow. It's that easy. And on the next slide, you'll see where these CII-CPAR consult reports sit in NetCare. So the uploaded specialist consult reports appear in a new section under the menu consultations. The reports uploaded will appear with the date and the type of consult. And hovering over the item on the list will pop up a tool tip with additional information.
So that's great to know that the physicians and multidisciplinary team members that are choosing this information option, that they can decide which consults they want to share. So that really is a choice for them. Tell us about the benefits. Tell us about the benefits to patients and providers when they start to see these consult reports in NetCare.
Right. Well, already there are close to 100,000 consults available on Alberta NetCare today. So one of the benefits is now that these consult reports are available to emergency and healthcare providers or hospital providers, and they can see it, what's happened from the community specialists. So really, just to say that again, community providers can submit consult reports from the community into Alberta NetCare. And so now our colleagues are benefiting from this. You know, we're seeing it in the clinics for maternity, diabetes, geriatrics, cardiology, neurology, that this information, where previously these key bits of information were being kept within community EMRs and were not accessible when these patients ended up in the emerge, hospital, or day surgery. And so as more and more community providers participate, there's an opportunity to reduce duplicate referrals and provide the right information at the right time to inform decision making.
So you really see the benefit is for the patient as well as their care teams within community and the acute care setting, so in both spaces. So tell us now about the third type of information that can be shared.
Right, so the third type of information is the confirmed panel list. So panels are uploaded to CIICPAR and then to the healthcare data repository. Right now, for people who are submitting it, they just have to press the button, and that's something that we have to do. But eventually, it's going to get automated to be the 8th of every month so that it goes up automatically. Yet, we'll still retain the capacity to manually upload with the click of a button which information we want to have. So once it goes up through the CII data hub, then it goes into the central patient attachment registry. It will create two types of reports for us. The first is the demographic mismatch report. So that tells us if a patient is deceased or if there's any mismatch on the information of that patient compared to the provincial registry. And then the second one is the panel conflict report. So that means that a patient who's on my confirmed panel also appears on someone else's confirmed panel. And so really, the thing that's nice is it shows when was the last time that patient was seen, for what reason, and when was the last time they were confirmed within that panel itself. And really just gives us as the providers an opportunity to talk to our patients about continuity and just really making sure that, hey, like, how can we avoid duplicating? How can we make sure that we take care of you well? Now, I should point out there is no penalty for people who have a patient that appears in a conflict report.
Thank you, Chris. So it's really great to hear that deceased notification, that's coming to community clinics now through that demographic mismatch report. It's the first time that you're receiving that information in your EMR. When you joined CII-CPAR, as you shared, it was the same time as you were building your practice. So thinking about physician effort, talk to us about what it looked like when you started to receive those demographic and mismatch reports and the conflict reports.
Right. So I think I benefited from having a very fresh patient panel. So it was easy for me to build my processes around that to make sure it was very clear who my patients were. And actually at the very beginning, my lists were very clean. You know, I didn't have anyone show up anywhere else because it was very clear that I was their primary provider. And it's only recently where I've started to have people pop up that way. And I'm really glad that I have PCM staff members to help me out. So that's actually something we're just trying to work out as a workflow to be able to integrate that well, and just checking the list and making sure that the list is still who we think it is.
Okay, great. So now that you've explained about the confirmed panels and how that goes up and is shared with the system, can you talk to us about how the panels and e-notifications are linked?
Right, and this is where I want to echo what Janet said earlier, is that once we have the confirmed panel, then that lets us have e-notifications. Now, the reason why this is important is because it gives us an alert when the patients are encountering an AHS facility. So whether that's an emerged discharge, a hospital admission, or discharge, or day surgery. And so that allows us to get these alerts to know where they are in real time. So it comes and it appears in our lab report tab. And so that's where you see it. So depending on how often you refresh it, you know, twice a day, that's where it comes in. And you're like, oh, they're here, and I can give them a call. So I get those e-notifications straight to my inbox. And so really, the thing that is worth mentioning is that e-notifications really only happen because we have a confirmed CPAR panel list. And so once that's confirmed, then that's how the system knows who the primary provider is. And exciting news is actually in the spring, Netcare will display the CPAR primary provider's name. Where it is, we're still kind of getting that figured out, but at least then it's very clear that, hey, this is the provider, these are the people that things should be going towards.
So you've really described the value of e-notifications as supporting the whole patient's medical home and that relational continuity and getting the right information at the right time. Now you can see how these benefits are really why physicians had asked for CPAR. Now, Janet, we get a lot of questions about patient confidentiality, privacy, and security. It's all around the CII-CPAR program. Can you share with us what you understand?
I mean, the most important thing is that only the mapped fields in your EMR flow to Netcare. Not all information from your EMR will go to Netcare. And you do have the option of leaving certain fields blank. And there are ways to set the confidentiality so that the information doesn't flow to Netcare. If you're already using Netcare, there's no further permission that you need to obtain from your patients. Information from pharmacies and labs are already flowing to Netcare, and the clinic EMR information can also flow to Netcare without getting individual permission from the patients.
Yeah, we've been looking at some of the research and the data recently where it talks about patients already believing this sharing is happening already, that it's more broad than it really is. It's exciting to be where we are. So can we talk some more about those patient and provider stories that I know you both have, and since you've been live on the system? Janet, may I ask you to start us off?
Well, the biggest benefit for me are the e-notifications. Now I know when my patients are going to and from hospital, and so that's great. There is a legacy feature in Netcare that allows you to pull that information, but you have to manually do it once or twice a day. And if you're away or you don't do it on the weekend, you might miss getting information about your patients. The e-notifications are pushed to you and you don't need to do anything more. They come twice a day at 8 a.m. and 6 a.m. and 2 p.m., 7 days a week. And they'll be in your lab report until you deal with them. So you'll see them. So it's fantastic for continuity. It really is great.
So Janet, I've heard you share another story before. It's about one of your patients who had COVID. It's such a impactful story. May I ask you to share that again?
Sure. So around New Year's this year, I got an e-notification that a 77-year-old regular patient of mine had been to emergency and been discharged the day before, the evening before. The emergency report wasn't on Netcare, so I just chose to phone the patient to find out why he had been to emergency. So I phoned him, and the story was that he had gone to emergency because his common law wife a few days before had been admitted with COVID, and he was coughing and was concerned that he might have COVID. So he told me that a COVID swab had been done. So then I checked Netcare and it was back and it was positive. So that allowed me to activate the primary care provider COVID pathway. And I could review his symptoms and discuss red flags and talk about follow-up, what to watch for. And so I started calling him daily to make sure that he was okay at home and review his symptoms. And then a few days later, he sadly told me that his wife had passed away from COVID. So at that point, I could also provide some emotional support because this was at the time of severe public health restrictions. So he couldn't have any family members visiting him or do anything in person. So he really appreciated the daily phone call. And I felt that I could provide him emotional support as well as provide him medical care to make sure that he recovered from his COVID, which he did. And he never needed to be hospitalized, which is great.
So when I hear your story, it focuses on CII-CPAR as that technology. It's the technology that really is about integration and continuity. I'd like you to also talk to us about how that technology supports transitions.
Right. Well, it's really important for us to know when our patients are being discharged from emergency or from hospital. And, with my gentleman with COVID, I would not have known that he had been to emergency were it not for the e-notification. He would have had to phone me because I would not have known. I didn't get the emergency report for about 10 days. So these e-notifications really help me determine what care my patients need when they are discharged from emergency or from hospital.
So it's great. So you can see how CII-CPAR enables multiple things the PCNs are working on right now. And it's exciting to see how we're really at that beginning phase of that integration and to see that bigger picture of where we're going to start to go. So Chris.
Absolutely, yeah.
Yeah. So Chris, can you share one of your patient stories?
Yeah, thanks for asking. So at our clinic, we see patients from Poundmakers Lodge, which is a residential treatment facility in St. Albert. And really, patients who attend residential treatment facilities, they don't have very much primary care in general. And there's usually little to no information from these facilities to guide what is happening for the medical care once they're in or gone or after that. And so CII-CPAR helped one of these patients who eventually became my patient. And so after she graduated, we had time to titrate her meds and really just work through what was happening just to get her in a good place. Now, unfortunately, her situation decompensated. She moved to rural Alberta, and I was still getting notifications when she would show up to the emerge or when she'd be admitted to hospital. And at one point, one of the team members called me up because they saw that I was her previous family doc, and so or was her family doc, and was able to just chat a bit about her care as they were trying to get her ready to go to another treatment facility. So just being identified as her family doctor helped me to be involved in her care, even when I wasn't directly seeing her.
So in your story, we really see the value of the primary provider as that quarterback, the quarterback of the patient's care, and even just that snapshot of the care that you were providing, how vital that was to help for those smoother transitions. So you both have shared those real life experiences where you see your own increased satisfaction as a physician, and you've shared the stories of your patients that have had better outcomes as a result of participating in CIICPAR. So let's get to the nitty gritty. Tell us about the effort. What does it look like to get involved? And once you're involved, what does it look like after?
So fortunately, there isn't a lot of work on the part of the physicians. All that really happened at my clinic was we had a team meeting with the physicians and staff so that everyone could understand what CII CPAR is and isn't, and what information would flow from our EMR to Netcare. And then I had an individual meeting with my Healthquest consultant to finalize what fields would be mapped and would flow there. And that meeting was about 10 minutes. It was very brief. My clinic manager did most of the paperwork and the administrative work, and she said it really wasn't that much effort and it was very smooth. And she had a lot of help from the PCN practice facilitator. Some of you, it might be your panel manager, but there was also help from an e-health consultant with Alberta Health Services and the AMA ACTT consultant, Kylie, as well. But overall, it was pretty smooth and simple. And some of the physicians didn't even really know what was happening until they saw the e-notifications in their lab reports one day. So that tells you how easy it was.
It's funny, we hear that a lot from a lot of our physicians that are live. It was like, what do you mean? I'm already sharing information. So that's a great story to share. So you have a well-established panel. So a question we get all the time is, so when those demographic mismatch reports come in and the conflict reports, tell us what that looked like in terms of your effort or your team's effort.
So the demographic report, at mismatch report, at first it might be a little bit big. Ours was, I think, 27 patients. But once we cleaned up little glitches like birth date, month and day reversed, or like we had a patient whose legal name was Kimberly, we had her listed as Kim. So once you fix little things like that, every month our demographic mismatch now is quite small. The panel conflict reports, it's just more information. It tells you, what other physicians your patients have been seeing, and what you do with that information is up to you.
So that's good to know. It isn't a timeline. It's about working through your process and starting to look at it as your quality improvement. So Chris, tell us about some of the challenges that you experience with Healthquest.
Yeah, that's a good question. So for me, I was notified that actually some of my encounters just didn't go up, and we looked at it. It was because there was a dash in the field where we put the average blood pressure. So I was very happy to delegate that to my PCN staff to look into it and just clarify where it was, so that things were formatted again, and so that resolved the issue. And another thing that was happening for me is just, especially where I was serving, I was dealing with a lot of complicated patients that required multiple entries during the day, whether I was talking to the pharmacy, to a consultant, things like that. And I just wanted to make sure that went up into the community digest report, just in case they may ever somehow end up in the emerge or something like that. And so initially, only one of those reports would go up onto the community encounter digest. So I talked to them, and so now it's been fixed. And so if I have multiple entries, all of them go up, as long as I do the sequencing that needs to happen.
Okay, great. So it's good to hear that it's also your PCN as part of your team supporting you and being able to have that communication with your vendor. So we've talked about what CIICPAR is. You both have shared what it isn't, where you see the value for both yourself as providers and for your patients. And you've shared what that physician effort really is and how it depends on your clinic context, how you're using and leveraging your EMR. Let's close off our session today with understanding what that current CIICPAR progress, what it actually looks like.
Yeah, so maybe what I want to start off with is that this is something that physicians asked for back in 2016. The section of general practice at the time asked for it to be developed. So by 2018, it was ready to be tested. And then physicians could start to sign up in about 2019 after the test phase. So currently we have just under 1,100 physicians in the province, either fully live or in progress. So we've made great strides, but there's lots of room for more physicians to sign up.
So what would you and Chris, what would you say for next steps for any physicians that are wanting to move ahead?
Well, you can definitely connect with your PCN. All the PCNs in the province are familiar with CII-CPAR and can provide help signing up. You can also talk to other physicians that are using CII-CPAR. There is information on the webpage at the AMA ACTT site, and you can also email continuity@albertadoctors.org.
That's great. Thank you, Janet. Thank you, Chris.
Thank you.